Hi, everyone. Thanks for joining us. Welcome to the webinar, Concierge Care Explained. We are hoping to kind of help you navigate this relatively new concept in medicine and especially in the Chicagoland area. At the end, we'll have a little Q&A session, so feel free to ask questions then. We hope that you find this helpful. Okay. Okay, awesome.
Okay, I'm just going to say hi and introduce myself really fast. So, welcome again. I'm Dr. Jessica Marabella. I own Boston Family Medicine here in Arlington Heights. I'm a family medicine physician. I've been in practice now for a little over 11 years, and previous to me opening this practice, I have been practicing locally in Arlington Heights over at Northwest Community Hospital, which is now Endeavor Hospital for those that are local. But I wanted to stay within the community and give back. So I wasn't loving how patient care was going at that practice. And I learned a lot, but I wanted to be able to give back to the community. And that's why I opened this concierge practice. So we'll explain a little bit more about that and how I'm able to give back to the community a little bit more. So, yeah.
Awesome. And I'm Dr. Julia Gold. I'm also a family medicine physician. I am the owner of Encore Concierge Medicine here in River North. And prior to this, I spent the last about 9 years working for also kind of a large corporate healthcare system. And so I'm excited to share with you what I've learned kind of living in both the traditional medicine world and concierge care, and hope you find it useful.
So today, just a brief overview so that way you guys know what to expect. We're going to kind of dive into the differences of what the traditional medicine is versus what exactly is concierge medicine. Some common fears people have about this, and the different models. True concierge medicine and a model called direct primary care, some frequently asked questions that we get, and then we're going to spin it around and see if you guys have any questions for us. So we're excited to dive in and kind of go over all this.
Awesome. Okay, so most people are pretty aware of the traditional medical system. We've all lived it before, so I'm not going to go too in detail of this, but I just wanted to go through a few aspects of traditional medical care just so you can see how that differs from concierge medicine. So typically, in these bigger systems, you'll see like larger patient panels. So anywhere from 2,000 to 3,000 patients per physician is pretty typical for primary care. Wait times can be a really long time to get in to get an appointment with people. So, sometimes 6 to 9 months or longer, depending on the specialty. Visit length times are very short, so they'll give you maybe a 15-minute visit. You spend a lot of that doing kind of admin things, and then the time with your physician's really only about 7 minutes on average, so not much time for anything. It's really focused more on problem-based care rather than preventative care, so they kind of wait till you're sick or something's going on to manage that. Lots of insurance barriers, as we all know. It can be really difficult to even just access your doctor after hours. If you want to message them, sometimes they reply, sometimes they never reply, or you can't really ever get them on the phone. So it's kind of hard to talk to them if you're not in the office during an actual visit. And sometimes you're required to see alternate providers. So if your doctor's busy, they can't see you for something, you'll have to see someone else that doesn't know you well.
Yeah, and just to kind of give you like an actual example of what a physician who's been in practice for a while, their patient panel size truly gets up to 3,000, 4,000 patients, and we're not capped. So we have to continue to accept new patients. So whether, you probably have experienced this, you try to get in with your doctor for your normal physical, and they're booked out 6, 9 months for your physical. And then when you get in, I've had to sign a paper that says you can only talk to your doctor for your physical. Anything else, you won't be allowed to talk to them about. You have to book another appointment. So that's just, what traditional medicine right now is like. So it's,
Yep.
we've all experienced it.
Yeah, visits are super rushed. If you have anything outside of kind of your regular checkup, they'll tell you to make another appointment, or they rush through it really quickly, and you kind of feel dismissed and unheard, which is I've felt that myself personally. So
Yeah, the patients are suffering.
yeah, exactly. So we can kind of differentiate that with concierge medicine.
Right. So, what is concierge medicine? It is essentially a personalized membership-based healthcare model that offers you more direct access to your physician, longer appointment times, and proactive, relationship-driven care without the constraints of the traditional insurance. So, what we love about this, the biggest benefits, is you get longer unrushed appointment times. You get same day or next day appointments. And the biggest benefit is that because we don't have the constraints of insurance, we're able to limit our patient panel size to maybe 250 or 300 patients only. And we can offer all these great benefits to our patients because we know them so well. We have that personalized connection, and you are able to get a hold of us directly, whether it's email, whether it's text messaging, or calling us. If you have a question, you don't have to worry about, am I going to hear back from the doctor? Am I going to have to wait 2 to 3 weeks to get in with an appointment with us? You have that direct access to your physician. That's why that personalized care is there for you, because we don't have the restraints of having to deal with insurance or the corporate health care. So we
Yeah.
also focus on preventative care and longevity, not just problem-based care. We develop that trust with the patient. We have a stronger doctor-patient relationship. We really get to know you and your story and your goals. So we want to make sure that you're the healthiest possible, to make sure that you live longer and you're able to reach your goals. So we really want to work with you together.
Yeah, and to jump on that too, what's the beauty of our model is that our services are separate from your insurance. So we're able to care for you without having to have the insurance dictate how much time we spend with you, how often you can see us, what kind of tests we can order, because we're separate from that, which is really nice. So along with that is transparent pricing. You know exactly what you're going to get. So there's no surprise bills. There are no copays at any visit that you come in. There's no deductible that you have to meet. Your membership covers all of your visits, so it's just really clear upfront what you're getting. We can coordinate care with your specialist or hospitalist team if you're admitted. We're able to share your medical history with them on your behalf, advocate for you, and coordinate care while you're there and after you leave. Um, Again, a big part of this, our goal is to avoid urgent care. So we want to manage as much as we can without you having to go to urgent cares or ERs. Most people will have issues addressed within 24 to 48 hours, which is the whole point. And then peace of mind, it's just really nice knowing that you've got someone in your corner that knows you really well, knows your medical history. If anything happens, hopefully it doesn't, but if it does, you know that you've got your doctor easy to reach right there for you anytime, kind of like a little mini insurance plan.
Yeah, and then also for me, we're in the middle of that generation gap, right? We have our parents that sometimes need a little bit more extra care, and then we're also taking care of our kids. So we want to make sure our parents are taken care of. So being able to go with them to their appointments and sitting there and not being rushed is a huge benefit for, a lot of this concierge care as well. So yeah,
Yep.
great.
Yeah, and we see, the whole family, infants all the way up to elderly. So same thing in well child appointments. I think it's really helpful to know you have as much time as you want to talk about questions and milestones, and lots of questions come up in parenthood. So I think that's also a really nice benefit.
For sure.
Okay, so there's another similar model to concierge that you may have heard about. This is called direct primary care. So it's very similar. There's a few differences there. So if you run across these and you're just kind of interested in knowing what are the major differences between these two, mostly for concierge, we charge a once a year annual membership fee, whereas direct primary care, typically it is a smaller fee that you just pay once a month. Also, what we call DPC, direct primary care, they don't bill insurance, but they may charge you for problem visits when you come in. They're pretty good about being upfront about those charges, but that's something to note there. They also have more time with you than traditional medicine does, but usually it's a little bit shorter than concierge care. So concierge, we typically have more time, and the reason for that is because the patient panels differ a bit. So in concierge, like we said, typically this says 200 to 600, but typically it's more like 250 to 300 for a concierge physician, whereas direct primary care can be anywhere from 5 to 800. So their appointment times will be a little bit shorter, but they again are it's still a very similar concept to concierge.
Yeah, and then just another thing, like when initially these models came out, True Concierge was you paid a little extra membership, but they also would bill your insurance. So every time you go to the doctor, they would bill your insurance. But then direct primary care didn't. So that's how they initially were distinguishing the two.
Mhm.
Nowadays, you see a little bit of a hybrid of both of them. So you have that more, you know, um, less patients, longer appointment times with the annual membership of a concierge service, but then we kind of cut out the middleman. So it's a hybrid of the concierge with that DPC component of no insurance. So that's kind of how a lot more practices that call themselves concierge is going towards now. And that's what Dr. Gold and I have kind of tailored our practice around.
Yeah. So there's different models depending on who you might call and see. So I think it's good to ask these questions and see exactly how they run their individual practices. But generally speaking, again, they're pretty similar, but they'll have these little differences you'll just want to check on depending on what you're looking for and what kind of needs that you have. Okay, so we can move on here to some common fears. It can feel really scary, I think, sometimes to leave the traditional healthcare model, even if we hate it. It's just kind of scary to do something new. Maybe you've been with your same PCP for many years, or it's just really hard to imagine kind of starting over, or you just have fears of, if I join a concierge practice, what would really happen if I get sick or something. Super normal. We hear these things all the time. So I just wanted to address a few of those fears. Some others might include like cost concerns, um, fear of like losing your insurance coverage potentially, or the specialists that you see, am I not going to be able to see them anymore? Will I still be able to go to the same hospital system that I'm used to going to? Will I really use it enough? So, is it even worth kind of paying for if I'm young and healthy? Is it worthwhile? Maybe being too exclusive or luxury focused is something we hear about. Being just skeptical about just the whole value really is, do I really need this is kind of a common fear that I hear. So we're going to go through a few questions here and we'll answer some of that, but let us know if there's any that kind of resonate with you or other fears that we can address too during this. Okay, so a few frequently asked questions. We're just going to go through a few that people typically ask us, and hopefully we'll address most of those. But again, please feel free to ask after this. We love to just know from your perspective, what kind of things are you thinking? What are barriers you have? What are questions you want to know about? Um, that's our goal here is to be really clear and upfront. So we want to answer those. So I will start with the first question here for Dr. Marabella. So what does the membership fee cover and what's not included?
Great. So usually I answer this by saying that the membership fee covers all of the primary care services that I offer in our office. So that includes a comprehensive annual exam. We do a full medical thorough history, head to toe exam in the office. It covers all point of care testing, which includes like strep, mono, COVID, flu, urine HCG if you need that, any and all EKGs, all sick visits, any problem visits, all office visits, any virtual visits. Essentially anything that I do for you, primary care services are all included. Um, Things that may not be included or we try to get covered by your insurance. are things like imaging, hospitalizations, we run through your insurance. You will never get a bill from our office for anything that's done here. So all that would be included in your membership. So it's great, you know.
Yep. Oops, sorry.
Oh,
We
go
we
ahead.
got one question too about do we do like women's healthcare visits? Absolutely. Pap smears, breast exams, any typical problem. What I usually say is if you need maybe like a biopsy or something more detailed like that, we'll usually send you to a gynecologist, but definitely all women's care is included. It's a good question.
Yes. Mm-hmm. Okay, Dr. Gold,
Good.
do you accept or bill insurance?
So, yes, we would like anything that we can get your insurance to cover, we'll do that. So, if you're paying for it, you have it, let's use it. If you don't, that's okay. You can certainly join Concierge or DPC without insurance. It works that way too. But if you have it, we'll try to get everything covered that we can. So, lab work, imaging, medications, specialist visits, ER visits, hospitalizations, all of that runs through typical medical insurance. So nothing changes in that way. And then anything that we do in our office, we will, again, try to get that covered. So our lab will bill your insurance for lab work that would already be covered, for example. So anything that's um, included in those. Now, any primary care issues, so again, your comprehensive annual with us, all of your sick or problem visits, being able to text us and video calls, all of those things are part of your membership. So that is separate, and a lot of insurance will not pay for those kinds of services under a concierge model. But we'll get to soon that you often can use other funding like HSA or FSA, but we'll chat about that one in a second.
And I like for that to kind of use an example. Like, my husband the other day, for example, messaged his primary care doctor, and granted, he's still at the old practice, and they did a quick virtual visit because he had a quick question. 3 weeks later, we get a bill in the mail because we haven't met our deductible yet, and it was $215 for that quick virtual visit. He didn't get anything prescribed, he didn't get any medication, but it was simply for a problem visit. So we got a surprise bill in the mail because we haven't met our deductible yet. So with our membership, you would never get that bill. A virtual visit is covered, and you would never get a bill for just a virtual visit. So it's an example how the difference between a traditional medicine and a membership would work. So a lot of times
Yep.
we avoid going to the doctor or going to an urgent care because we don't want those surprise bills. So
Mhm.
once again, another peace of mind that you have your concierge doctor.
Yep. And I'm just going through a couple more questions here. I hope that answered the do you bill insurance for labs? So our lab that we have partnered with, and again, I say we because Dr. Marabella and I have very similar practice models, but we are completely separate and are totally different parts of Chicagoland area. But we run so similarly. That's why I say we, if that's confusing. But the labs that we have partnered with offer concierge practices and private practices discounted rates. So because we're not contracted with insurance, they give us much closer to a true cost of a lab test than you would see if they were trying to run that through insurance, for example. The example I always give is like vitamin D levels. If I were to order a vitamin D, it would be something like $20. But if the lab were to bill an insurance for that, it would be like $250 or more. So they'll give us a really detailed list of all the labs that they can do, which is, thousands of labs. And we can show the patient, hey, if there's something here that's extra or advanced that you want to do that we know your insurance won't pay for, here's the price that we have, and you can just pay that exactly upfront ahead of time. You're not going to get a bill later, and know what you're getting directly. So that's how the insurance is billed for labs. And similar to vaccines is the same concept there. Your normal health insurance would cover vaccines.
What sort of diet plans do you work with? So obviously I'm not a dietitian, but I work closely with vetted dietitians that we can get you in with, and we talk about what's working for you, what have you tried before, and then we get you in with the dietitian specifically. But if you're trying to get like weight loss or something like that, we see what you've tried before. I usually recommend, starting off with A, B, and C, and then kind of go from there. Specifically, like, I know my patients that are on like GLP-1s, we make sure that you're eating enough protein, we're getting enough water, the basics I know, but then as far as specific diet plans, I usually refer you out to one of my vetted dietitians that I trust.
Yeah, and we work really closely with them too. So we'll kind of, with your permission, of course, share your medical information with them and kind of come up with more of a customized plan, along with lab work that we do and kind of your history of. Everyone's got their own medical history of dieting and what they've tried before, what they are ready to try now. And that's the goal is to sit down and talk with you to be much more specific to you and your plan rather than kind of a blanket, hey, your cholesterol's high, you should decrease red meat. Like this is much more detailed and personalized to you. Um, and again, let me know for anyone if there's questions that we didn't really thoroughly answer for you. But do you charge more for infants and young children that have more frequent visits? I love that you worded it that way because a lot of times people think that children would be like a lower price. They'll ask, do you have like discounted rates for children? And in fact, children are love them. I've got three myself, but they are some of the highest maintenance people out there. There's a lot of questions, there's a lot of changes that happen during from birth till it never ends, I guess, but till adulthood. And we don't charge more. We do offer in our office a discounted rate for family members. So anybody that is, and Jessica, Dr. Marabella, you can answer if you have it, if yours is different than this, but a 10% discount for any spouses or children that live with you. So that would be as a family. I love having the whole family in the office. So we definitely want to give you a discounted rate there. But otherwise, we don't specifically charge more, though. No.
We don't
Um,
charge more either. We do a little bit different of a family plan. So, um, but it's different per age just because of my area is a little bit different than downtown Chicago. But yes, we don't do higher rates for younger children just because they are required to have more visits.
mhm.
Um, and then as far as do you offer back to school physicals? Of course we do. If you're a member, we do back to school physicals. And we'd be happy to do that, especially because we're getting to that time. It's, something that's required and we should be doing it. And that's one of my favorite things to do is kind of go over everything. It's a great time to connect with the kids, make sure that they're hitting all their milestones and they're growing appropriately. So yeah, would
Yeah,
love
yeah,
to.
absolutely. Anything in our scope of practice that we can manage, all included in your membership. So anything like that, it would definitely be part of that membership. Do you offer remote patient monitoring? If so, how do you facilitate it? Um, Maybe Jessica has a better answer. Can you maybe give me a little more detail on that question?
So I think it's more like, maybe if I, do you mean like if they don't live here or do they live a little bit further? So that's at
Yeah,
least how
maybe.
I'm kind of taking that. So I need to see them at least once, if not twice a year. They need to be seen in my office. And then we do like more virtual visits or something like that. So like mine, for example, if they're like snowbirds and they spend half their time here and half their time in like Florida, that's how I remote manage them.
Hmm.
Obviously, those patients know that sometimes when they call me and they're living in Florida, that they need to be seen for something like if they need their lungs listened to, then they go see someone down there, and there's not a whole lot that I can do at that point, but I give them guidance, I give them recommendations or what they should do. And while they're here, it's really easy for me to manage them, but when they're not here, they have me to call and ask, what should I do for this or how do I manage this? Where should I go? I'm readily available for them still. And if it's something I can manage over the phone, I do. But if it's something that they need to be seen for, then they go see a doctor that's wherever they are.
Yeah. And she
If
did
I didn't answer
clarify
your
here.
question, just let me know.
Yeah, she wrote here, so helping with health goals between visits. How's my blood pressure trending, for example? How's my weight changing, for example?
Oh, okay.
Yeah. Yeah,
Yeah, so like
absolutely.
if you
Hmm.
have, yes, real easy. We get you a at-home blood pressure cuff. You have a scale at home. It's really easy for us to check in that way.
Yeah, that's the goal is to keep monitoring throughout. Like if we start a new medication for you, um, we're always checking in. How's it going? Did you pick it up? Do you like it? Do we need to adjust the dosing? The goal of is to definitely manage things just more conveniently for you. So you don't have to come into the office every time to check your blood pressure or to change a dose or something like that.
Mhm.
Hopefully that helps.
I don't know about Dr. Gold, but we offer a one-time walk-in visit. So if you're unsure about concierge medicine, but you want to do a trial and you happen to have like you're sick that day, or you think you might have sore throat and you were kind of on the fence, but you want to just come in and meet me and do that one sick visit. We do offer a one-time walk-in visit before you're a member. And then during that time, you pay a one-time fee, and then you have 30 days to convert to be a member, and that fee does go apply towards the membership. That's the only time we ever do walk-ins. Otherwise, the walk-in would only be for like a member. They can call me saying they're on their way, and we usually are able to squeeze you in for a walk-in if you're a member.
Yeah, I was going to say, I'm not sure on that question if you mean if you're a member already or if you're not yet. If you are not a member, we're similar to that. I don't put a limit on it, but if you have, say, yeah, a cold or something, and you just really want to try it out, you're not really sure if you want to join yet, you want to see how it's going, come in. Ours is $300 flat fee. We'll include any kind of point of care testing with that. And then you can just feel it out and see, this is how this would be, this is what it would feel like, and then decide later if you want to be a member. If you do, we'll use that towards your membership fee. If you're not ready, you want to try it again 6 months later, go ahead. We're kind of here to let you feel it out and see. But what we can't do is preventative care in those visits. Those do require more follow-up. If we did find anything that would be, high blood pressure or something that we need follow-up with, that gets a little bit on the legal side, a little bit more confusing. So that's why we keep that to just kind of acute visits that you would do a walk-in for. Hopefully that answered that question.
We have a
Yeah, go
question
ahead.
about if you are unable to bring, can you bring your child into for a visit if you can't
Oh,
secure childcare?
totally.
Totally,
Yeah,
yes. Like this
yeah,
is a safe environment. We structure the appointments so that way there's not anyone in the waiting room. We have plenty of room. We can help you out if you don't want your child in the waiting room. We have our medical assistant that would be more than happy to help you out during that situation. So this is a very family-oriented practice. At least I know mine is. I say we again because me and Dr. Gold are very similar in how we practice and how we think. So of course,
yeah,
bring your kids if
yeah.
you need to.
My
My kids love
quick
my
funny,
practice.
yeah, exactly. I was gonna say my quick funny story on that was as we were building out, we had, the blueprints and we were building a like a break room, a staff break room, and we told my kids that we would have a TV in there. And the whole time they kept asking when their kid room was going to be ready. And I'm like, it's not a kid room, it is a staff break room. But they love it. And we have certainly had patients who bring their kiddos in and sit and watch TV if they want and have snacks. We have a whole snack bar up front that we're constantly adjusting for what people like and want. And yes, absolutely. We want to care for everyone like that. What if my child needs a sports physical for school and they're not a member? Can I pay to bring them in for that? So that is also considered more like preventative care. We don't have that model yet, and this was more of a legal issue that I discussed with my attorney. That doing preventative care like that gets you in a position of really having to, you're not able to follow up because they're not a member, and so if anything is found during that time, then you're in this gray zone of what are we supposed to do about that. So, I mean, in an ideal world, everyone's healthy and you just sign the form, but when things aren't well, if the patient's sick or if we have a finding that's really concerning, that's where the issue lies. So, but if you had, let's say, a child that was sick and you wanted to kind of try out concierge care for them, you could certainly bring them in and do any kind of sick visit or problem visit. And we're happy to manage that as that kind of walk-in model.
Mhm. Would a member come into the office if they needed any type of stitches for any reason? I do basic stitches. I have it here. I'm able to do it. Obviously, if you see bone, I don't recommend you coming in here. But yes, I could do like, if you cut your hand, you cut, your arm, and it's like, not like 10 o'clock at night. But yeah, I could stitch you up, but that's me. I don't know if Dr. Gold does that.
Yeah, and I think what's great is that what you would probably do first is give us a call and say, hey, here's what I did. Here's like a video or a photo of, my hand that's cut or something.
Yeah.
What do you recommend? And before we kind of, have you waste your time driving over here and looking at it, we could kind of remotely say, you know what, I think that one probably needs to go to an urgent care, or that one needs to go to the ER or something like that. Or, put a Band-Aid on that. That looks okay for now. But giving you
Hmm.
that direction, I think is a really big part of our model.
Yeah. We try to limit, like you said earlier, we kind of try to save your time. Your time is precious, right? So we want to help direct you that would benefit you the most. We want to be able to keep you here if we can. And if we know it's something out of our scope and you need more acute, higher care, we would help you there too. And we try to do handoffs as well with specialists. We have a broad range of specialist care that we talk to personally. We can text and get you in. So that's also another benefit with concierge medicine too, that we can do a handoff rather than just being like, here's the card, go make that appointment.
Okay. Oh, look, my light went off in my office. Okay, sorry about that. Let's see. What would it look like if I did monthly payments and all of a sudden I couldn't afford it anymore? And this happens, right? I mean, the
Mhm.
economy, it's unpredictable. We don't know what's going on right now. The last thing we want to do is just kind of leave you high and dry. So we have had patients that will pause membership for a little while. We've had patients say, I can't pay for this month, or I can only pay this amount for this month. And we'll definitely work through a payment situation with you, whatever is going to be helpful for you. Because again, the goal isn't to kind of just drop you when things get tough. The goal is to care for you long term. So I always encourage people to reach out if there's anything financial that's happening. Let's have a conversation about that. Don't feel like you are kind of alone in that and that it's an all or nothing situation.
Exactly. We're here for patient care. That's why we became doctors. We're not in it, you know, for the financial gain. Obviously it's a business, but we're here to help you. So please reach out.
Yep.
Are you
Um,
able to
Go ahead.
do any testing like strep, flu, walk-in sick, or would that be extra fee if I'm not a member? Again, like we kind of said earlier, we do offer that one or like Dr. Gold has a couple, there's no limit. We could do a walk-in so you can kind of test out what concierge medicine is like. And we would do that point of care like strep, flu, if you're sick, that would be included in that one-time visit. For me, it's $250. For Dr. Gold, it's $300 for that one-time visit if you're not a member. And then you have that option to use that and convert it into the membership if you decide that you like it and you like it here and you like us. Um, but
But
if
yeah, it would, yeah, if you needed something during the goal is, yeah, if you come in with a sore throat, we would absolutely include like a strep test or a flu test, urine testing, pregnancy testing, all of those kind of basic tests that we just carry in our office. That would be all
Mhm.
included in that single time fee. It's only if we needed to say, send a culture out and have your insurance cover that, that might be something that your insurance would say they would send you a bill for later or something extra, but you would know about that up front and make that decision with us before you any surprises come.
Right, we let you know.
Let's see, does that apply for burns also? Similar thing. So it's if we feel like it's a minor burn that should be managed in an outpatient primary care setting, then absolutely we'll do it. If it's something that is deeper, that looks more concerning, a lot of patients like that, you'll need to be in a burn center, but that would be us helping you coordinate. Where is the burn center? Who do I see? How much follow-up do I need? All of that kind of stuff.
Do you do prostate checks for male patients? Yeah, of course. We see a ton like male patient, female, just like we do women's health, we do male health as well. So if it's indicated and we need to do a prostate check during your physical exam, we would let you know. We would kind of walk you through it. If, of course, you're not comfortable, then you let us know. But if it's indicated during that exam that you need a prostate exam, then we do it.
Yeah, typical primary care. That's super
Hmm.
easy. And we skipped one earlier, I think. What if I need to have my blood work done? Where can I have labs drawn? Um, we draw blood in office. We have a lab in the office here, so everything is done. I have not at all run into yet a lab that we can't order or that needs to be sent, needs to have you go somewhere else to draw it for any reason. I think there's some very rare labs out there that might need to be, frozen immediately or something like that that we would maybe send you. But again, I haven't run into that yet, and it's been really easy to just do everything in-house so far.
Same. If you prefer to get it done somewhere else, we send you to the local lab that's right down the street from us. But if it's super convenient to get it done in my office, but if you prefer to we have so many labs around us that we can easily send it to whatever's convenient for you.
Yep.
Can
Go
someone
ahead.
come in and see the practice and meet in person, or are we still on the fence about signing up?
Totally. Yes.
Uh, yes, of course. Please do a meet and greet with us. We would love to meet you. It's completely free. Come in and meet us. You
Get
can
some
ask us.
coffee, snacks. Yeah.
Yes, love it. We encourage that. We want you to come meet us. We prefer you to come meet us. That way you feel a sense for what the practice is like. You see the practice and get a sense for what, how it'll be. I actually strongly recommend that. And that way you know what it's going to be like. And we
Yeah.
have you sign an agreement, but there's no commitment to it. So like if you like say a few months down the road, you're like, you know what, I don't know, we are meshing well. There's no like you don't have to be with us. So
Yeah.
I
No
always give that option
contract.
too. Exactly.
Yeah, yeah. The agreement is mostly for you to kind of understand what we're offering you and kind of expectations for the practice. So it's nothing that is contractual. You're not stuck with us for a year or something if you're not happy. My model is to refund you whatever portion of the year you haven't used if you're not happy. So um, it's not like once you're here, you can't ever go back to the old system again, and you kind of have to all or nothing it. That's not the case. You can always try it out. You know what? This isn't for me, and cancel and go back to what you need to do, whatever fits for you. So, yeah.
That's great. Yeah.
Do you manage anxiety, depression, PTSD? Absolutely. Also, pretty bread and butter for primary care is to manage those kind of things. If you need a psychiatrist, if it's something that we feel is out of our realm of specialty or that it's too advanced that we don't want to, kind of step on that, we'll certainly have you see a psychiatrist. And I believe Dr. Marabella does as well, but we have a specialist list that we give to all of our members that people that we have really vetted, people that we know that you're going to have a good experience with. It is not just kind of an insurance list of here, call around, hopefully this works out for you. But it's people that I personally met with them, I know them. It's someone I would never refer you out to anyone else. So and again,
Right.
if you see them, we would follow up on the notes. We'd be able to kind of coordinate what are the next steps now. It isn't just see the specialist and then leave it in a void. It's now what, and that's our goal too, is to kind of go through all of that, manage the full picture for you.
Mm-hmm. Yeah. We want the best care for you.
Yeah, absolutely.
How can I view my test results? Would I still use my chart? So for me, my test results still currently go through my chart, but eventually they're also going to be going through our patient portal, which is through my EMR as well. So they go through both. I don't know about Dr. Gold. How do you review your test results?
The same. Yep. So they go through our medical record system. We also give you a PDF so you can look at everything yourself. I usually send a really detailed email to you after your lab results come in, just detailing everything, all of my notes on your results. And that's, of course, through a HIPAA compliant platform there. But that way you can refer back to it. I think when we just call you and say everything, it's too overwhelming. So it's a nice kind of template for you to look through and remember kind of what I thought about your results. And then often we'll schedule like a phone call or a video visit to follow up on it, just answer your questions and kind of discuss next steps and things like that.
I love
I
it.
am just going to put up one little screen here before we get too far, just in case anyone needs to hop off and go to lunch or something. If you want our contact information, that's here, our phone numbers and emails and websites, and then you can scan those QR codes that go to our individual websites. But please, we're here to hang out, so feel free to ask all the questions you want. I'll jump on this one too. Why did you decide to become a concierge doctor? Um, I didn't think of it initially. It wasn't like a long-term plan that I had. I was actually offered in my prior practice to um, buy a practice from a retiring physician. And very long story short, after tons of research, meeting with different groups, meeting with different concierge physicians, DPC physicians, um, you know, maybe ignorance is bliss, but I just thought to myself, I think I can just do this on my own. And so I did. I'm so thankful. The model is incredible, not just for patients, but for us too, as physicians, to not just have a million people to see all day long and rush through visits and feel like you never really did anything thoroughly. We're able now to just really get to know people, get to know their lifestyles, their family life, like things that really affect their health. And nothing is rushed. It just feels like true, good, thorough care for each person. And I'll never go back to traditional medicine. It's really incredible. And but yeah, that's how that was my little story there.
I'll kind of just jump on the bandwagon. For me, really, it was more, I have two young kids and I really wanted to spend more time with my family. And I really miss the patient connection that I was why I went into family medicine, that continuity of care, really getting to learn the stories of my patients, learning about their family, their parents, their kids. I was missing that connection. So this has allowed me to do that again. And I love being able to spend time with them and then also not missing things with my family. So I would
Yeah.
never go back to how that traditional medicine is. And I feel like I'm actually going back to patient care. So
Yeah.
it's making me
Having a
happy, and I think my patients are happy too.
Yeah, I think a healthy work-life balance is something we always recommend for our own patients and therefore ourselves, like should model it ourselves too. So we do that, we encourage that of our own patients. But having said that, of course, we're here for you. That is the goal. So
Yes.
do you do skin checks? Are you able to remove moles? Yes. Now, that's one of those things that I love my dermatologist. They have an eye for these things because they're really trained in it. And there may be a mole that to me looks okay, to them looks concerning.
Hmm.
And I just say that because I do think it's smart to have a trained dermatologist looking at your skin, however often they recommend, once a year or whatever for your specific case. We easily do mole checks though. If there's something that looks like, hey, I just noticed this thing, what do you think? Of course. And we can do biopsies and things like that too. But again, I don't think there's any replacement for a good dermatologist to do kind of a full screen, um, annually.
Agreed. Do you do referral programs for your current members? Yes, I do. My current referral program right now is if you refer a new patient, and they sign up, you get a month worth off your next year's membership. So,
Mhm.
yeah,
Yep,
love
similar. And
referrals.
yeah, absolutely. We do the same thing. We definitely we I love my patients. I want more of them like them. I want their
Exactly.
families, I want their friends. So absolutely our current patients we definitely incentivize if they are able to bring in more of them. That's what we want. And let's see, do you do at-home visits? So I love the concept of this. I haven't found the need yet in our current patient panel. I've certainly not, cross that off. I am constantly, I think Dr. Marabella too, pivoting our practice to fit what our patients want and need. And if that becomes something that people find valuable, I'm all about it. I think that would be really cool. I think that kind of really gets it back to, what medicine used to be like, and certainly a possibility. So I think that's one of those um, per case basis. If there's someone that needs that and would benefit from that, I'm all about that conversation.
I love it. These questions were great. I'm so glad you guys found this useful and it was interactive. And yeah, so we're
Yeah.
here if you guys think of any other questions.
Yeah. And Dr. Marabella, I was going to say maybe we can pop back really. I think there was like two we didn't get to,
Oh, perfect.
or a couple back here just in case anybody thinks of this later. But so what happens if you're on vacation?
Oh, yes. So we always have someone covering us if we ever go on vacation, right? Even though I would love to be on vacation all the time, but right, there's always someone. So typically we arrange coverage with a trusted colleague. So if it's something minor, I'm available, but usually if it's something more urgent, there's a colleague covering for me while I'm out of town. But usually I'm readily available still, even if I'm out of town.
Yep, that's what we're there for, whether we're in town or just on the weekends. If you need something, our goal is to help you navigate that, do a virtual visit if possible, manage as much as we can. But again, in the rare case that we're on true vacation, we'll have a trusted colleague that's kind of taking over care for that period of time.
Speaking of traveling,
Um,
what happens if the patient's traveling and needs care after hours?
Yeah, same thing is that whether you're in another state or you're just in Chicago area, and you need something, again, I try to do as much virtually as I can or over the phone, just because I think that's really convenient for people. However, if it's something we need to look at, we'll try to make it, easy and as possible on you. But if you're, in another state and you wake up with a sore throat and we decide that we need to send you a prescription, we'll do that. We'll send it to whatever pharmacy is close by to where you are. And again, try to manage as much as we can without having you go to urgent cares or ERs or anything wherever you're traveling.
Perfect.
And then the last one is that can I use my HSA or FSA funds to pay for membership fees?
Yeah, in many cases you can. It all depends on the specific plan. So we always recommend that you just check in with that specific insurance plan. And usually, we actually recommend when you're signing up for, an open enrollment, that you switch to the high deductible plan with the HSA available. So in that way, you actually get some benefit from it. Because, like, say you need medication, have like you need imaging or anything, that's when you would use that HSA also. And then we wouldn't be touching that deductible. So you're paying less per month for that insurance, and you would just be using it for our membership. So that way you're saving money in the long run.
Yep, most people, especially young, healthy people, will not use um, not reach that deductible, so if you're able to do the HSA, again, your monthly payments are lower, and then they'll I'm sorry, if you can do a high deductible plan, the monthly payments would be lower. You'll have access to HSA, and we'll certainly try to use that for our membership fee coverage if your insurance will approve it, which again, a lot will. So
Great.
okay, awesome. Again, I hope that everything was informative and helpful, and we are here. We would love to hear from you if you ever want to reach out, send us an email or give us a call. We'd love to continue the conversation, answer questions, have you come look around, try it out, see what you think, and thank you for joining. Thanks for your precious time today, and we hope you still have time for a little lunch, and thanks again.
Yeah. Thank you guys. Take care.